A man is stumbling down a sidewalk outside of a bar. He looks confused, he's sweaty, and his breath smells like wine. A normal person would say, "Look at that drunk." But a nurse would say, "This guy is diaphoretic, confused, disoriented. He's stumbling and his breath smells like fruit. He could be suffering from a life-threatening condition called diabetic ketoacidosis." In nursing, communication is the most important aspect. In terms of client care, in terms of everything that's done by a nurse, communication is the number one requirement. The first thing we're going to talk about today is a little bit of listening. Now, in terms of listening, a nurse, would you understand, they listen with a stethoscope to heart sounds and breath sounds. But that's just the initial hearing. Listening and hearing are two different things. A Yale study says, according to their website, a Yale study says that you can listen and not hear, and you can look and not see. And the program is designed to teach nurses and nursing students to look at pieces of the whole picture and redefine the picture. So looking at a series of trees and deciding that it's a forest, instead of looking at a bunch of trees and calling it a forest initially. We're also going to talk about critical thinking. In terms of critical thinking, the Think Communication book, the publication for this class that I had to take, defines critical thinking as the thought process used to analyze what you see or read to arrive at a justified conclusion or decision. Nurses critically think all the time. They take data from charts, from the patient, from various sources, and recombine it to depict what's wrong with the patient. You listen to a report and you decide what the next course of action would be for that patient. You hear orders from a doctor and you determine, is it safe for the patient? All these things are critical aspects of critical thinking. One of the most crucial aspects of nursing is nonverbal communication. Now, it starts with eye contact, a little simple pat on the arm. You're in their personal space. You're doing invasive procedures constantly. So when you're right there in their face and doing all these things, the eye contact is crucial. Some cultures don't like eye contact, other cultures do. It's a nurse's prerogative, and it's in the nurse's best interest to know what cultures appreciate those kind of gestures and what don't. It also includes therapeutic touch, the pat on the shoulder, the pat on the arm, the warm greetings and smiles when you walk into a room. Those things are crucial to patient comfort and patient care. Patients who have a friendly nurse are more likely to report a positive outcome at the hospital than patients that have a really good technical nurse that has no bedside manner. The third thing about nonverbal communication is simply presence. Often a nurse will be able to do most of her work from a nursing station outside of the room. But if a nurse is doing what's best for the client or best for the patient, they'll be in the room right there listening to what a patient has to say, taking extra time with the families, taking time with the patient, giving the patient just a little bit more comfort, general comfort. In terms of medical terminology, when you hear the word diaphoresis, the average person would say, I have no clue what that means. But diaphoresis is simply sweating. Nurses are required to take these medical terminologies and turn them into something usable for a regular client. So somebody who has just layman's terms. If you say an antipyretic, most people would say, I have no clue if I take one of those or not. But if I tell you that an antipyretic is an aspirin or a Tylenol, well then by all means you would understand what I'm talking about. Dysuria. Seems like a big scary word. Reality, it just means painful urination. Apnea, not breathing. That's a more common used term, and people hear it more often because of sleep apnea, which is a pretty common condition. Nurses help translate all these medical terminologies and translate them into an opportunity to educate the patient on what's going on with them. So if a nurse reads a chart and sees a list of diagnoses all in medical terminology, she or he can take that information and translate it to the patient. Nurses deal with listening, critical thinking, nonverbal communication, and translate medical terminology every day. That's why communication is such an important aspect of a nursing career. So next time you're walking down the street and you see a guy stumbling, don't take it for granted that he's just drunk, but think, what would a nurse do? And communicate.